Recognize Dr. Burgess for his 5 minutes of questions.
Thank you, Mr. Chairman. I appreciate your aggression. Dr. Walensky, just a quick follow-up from something Chairwoman Morris Rogers said. You maintained that your guidance is your guidance, but I presume if there's new data that comes forward, you will reevaluate your guidance. Is that not correct?
Of course, we're already reevaluating in real time.
And just a general statement, look, the country's been through hell with this. Our doctors and nurses on the front lines been through hell. You all in public health have been through hell, and policymakers have been through hell. There's a piece making the rounds currently, a Newsweek op-ed piece written by a doctor, or medical student, more correctly, Kevin Bass, and he observes, "It's clear to me that for public trust to be restored in science, scientists should publicly discuss what went right and what went wrong during the pandemic and where we could have done better. It is okay to be wrong and admit where one was wrong and what one has learned. That's a central part of the way science worked." So it's with that backdrop, and I appreciate so much Dr. to be Kevin Bass making that observation and sharing it with us. Look, you and your predecessors, when this was visited upon us, you didn't know what was to come. And it made things very, very difficult. And sometimes I think it's okay just to have the humility that we didn't anticipate that there'd be that 2-week lag. And when Dr. Fauci came and talked to this in this room about what a good job they'd done with SARS-1, nobody knew at that point about that 2-week lag that might occur from exposure. Now you're infective, and now you're symptomatic and should be isolated. Dr. Trebek, I do have a couple of questions. You know, we got the big OIG report the other day, and it generated a lot of interest. Some questions have come up from that. Let me just ask you roughly, how many awards does National Institute of Health issue every year?
About 55,000.
So that's a lot. In the report, in the OIG report, they obviously discuss there were some potential risks associated with research being performed under EcoHealth Awards. NIH did not effectively monitor or take timely action to address EcoHealth's compliance with some requirements. These costs included salaries exceeding the NIH salary cap, employee bonuses, travel costs, tuition costs, indirect costs. This audit covered all 3 NIH awards to EcoHealth between 2014 and 2021 and found $89,171 in allowable costs. That's in 1 grant. And you just said, how many grants do you administer?
We about 55,000 a year.
So 89,000 multiplied by 55,000 is a lot. Are you taking steps to tighten this process up so we don't have 55,000 OIG reports down the road?
So certainly this is an outlier, and
Dr. Trebek, with all due respect, we're not sure because we didn't know about the outlier status of the current OIG report.
I take your point. We accepted all of the OIG's recommendations, and we are working to redress each of them. We now have modified our systems to prevent some of these missteps from occurring.
So you will get back to us with your plan.
Happy to do that, yes.
Let me just ask you too, because you made the offhand comment that disbarment resides with an official at HHS.
That's correct.
Official?
I don't know the name of the person, but there is a disbarment office.
Will you get that? Because I'm interested in speaking with that individual.
Sure.
So let me ask you a question. This committee, back in 2006, I know it was a long time ago, the NIH Reform Act established the Scientific Management Review Board, an oversight board meant to make NIH more efficient. This board has not convened since 2015, according to recently published information in a healthcare publication. And the members of the board don't know why they haven't met. Can you enlighten us as to why that board is no longer meeting?
The board no longer meets because we found that board to be completely redundant to the advisory committee, to the director, in every aspect.
So that's good, and I'll stipulate that. However, the annual cost of the board, $488,000 a year, 2 full-time employees at a cost of over $320,000. Without convening the board, I'm concerned that the NIH may have diverted these funds to other activities. It
Well,
still appears on your books.
okay, I will check into that and get back to you, sir.
Thank you, Mr. Chairman. I've got a lot of questions that I'm going to submit for the record. Clearly, there's a lot of pent-up demand because of the 3 years of the pandemic and this really being the first oversight hearing we've had in person in a long time. So thank you, Mr. Chairman, and I'll yield back.
Thank the gentleman.